Okay, PFRANKMD fans. It is case of the week, and I'm very excited about this one because it is an extremely satisfying procedure. We are talking about lipoma removal. Now, this is done with Tumescent microcannula liposuction, but we use a special instrument, an ultrasound-assisted device called the Vaser, that really makes this procedure super effective, super simple, and just a much better option than some of the other surgeries. Now, let me first mention what lipomas are. Lipomas are a benign, fatty tumor. They can be painful in certain cases, they can have blood vessels in them, but they rarely ever progress to anything that could be potentially dangerous. And for most people, they are purely of cosmetic concern. But they can be in certain areas that are functionally difficult, and they can grow quite large. This is a perfect example of someone that came in with a very large one on the back and literally was restricted with motion. People get it over here, they'll get it on the abdomen area, on the leg, on areas of tension, the shoulder, the knee, the wrist, and it can be not only cosmetically unappealing, but it can be functionally difficult. Now, the traditional approach to removing lipomas is surgical excision, which does work. It has a small chance of recurrence, but it does work, but it leaves quite a bit of scarring. On a lipoma of this size, the patient would need, 6 to 12 inches of a scar, which not only leaves an unsightly mark, but really restricts the recovery of the whole aspect, almost having to put yourself in a limited sling. Using Tumescent microcannula liposuction, we could accomplish everything through 2 tiny holes. Patients are performed purely under local anesthesia. They can get a little bit of sedation, but this is a very simple outpatient procedure. It takes about an hour in my operating suite uptown. Once the local anesthesia is in, which takes all of about 90 seconds to 180 seconds, the patient's done. They feel nothing. The area is tumesced. And what I do is I place the ultrasound-assisted device inside to melt the fat and actually destroy the stem cells that can create recurrence. So ideally, we are dramatically decreasing the recurrence of these. Once the fat is melted, we extract it with these microcannula instruments, which you've seen before on my social media, and then we just bandage it. It's really just a 24-hour recovery. They can resume mild exercise in 5 days, and really 9 out of 10 patients just go to work the next day. It's simple, it's safe, and it's effective. And as little as 5 to 7 days, you can really see the whole thing totally flattened out. These are the 2 little holes that were made. They will be totally unnoticeable. Here's another patient. This is actually a woman who had very asymmetric bra fat, and it ended up being an actual lipoma that was creating this. Again, this is 1 week later. So, avoidance of large scars, more consistent lack of recurrence of lipomas, simple, safe, effective, right here at PFRANKMD. Giant lipoma removal. See you later, guys.